Caring for a pet's dental needs is a key component to the overall preventative health program we are striving to provide for the pets that come to your veterinary hospital. Understanding and educating your valued clients to these important needs is the responsibility of everyone on the animal health care team: the veterinarian, the receptionist, the technician, and the assistant. In this series on dental care, you will learn about the following skills: the basic anatomy of the tooth, aging puppies and kittens based on their teeth, home dental care techniques, step-by-step instruction on how to professionally scale and polish teeth, and a brief overview of various dental procedures that are available. We will begin with the anatomy of the tooth. The visible portion of the tooth above the gum line is the crown. The crown is covered by enamel. Below the gum line is the root, which is primarily composed of dentin, which is covered by cementum. Within the tooth is the pulp cavity, which contains the pulp of the tooth. The pulp is comprised of blood vessels, nerves, and other specialized cells, which nourish and maintain the tooth. The tooth is anchored into the jaws by the periodontal ligament, which attaches to the alveolar bone and to the cementum of the root. The pink tissue we often call the gums is more appropriately called the gingiva. This tissue will generally form a smooth junction with the tooth, creating protection for the root structures below. Additional anatomy will be added later, but for now you should be familiar with the crown, the root or roots, the pulp cavity, and the cementum and periodontal ligaments that attach each tooth into their respective sockets. The names that identify the teeth will now be discussed. We will begin with the incisors. The incisors are the small teeth that occupy the front of the mouth. There are typically 6 of these teeth in the upper jaw or maxilla, and typically 6 incisors in the lower jaw or mandible. These incisors will have a single root and function to incise or cut the food. For accurate record keeping, the teeth are numbered as shown here. Adjacent to the incisors are the canines. The canine tooth is a large, single-rooted tooth that protrudes well beyond the other teeth, giving them the distinctive look of a fang. The mandibular canines are important for holding the tongue in the mouth. Additionally, the extensive root structure of the canine is needed to maintain the integrity of the jaw. If the tooth is extracted, it is very important to replace it with a bone matrix material. The third group of teeth are the premolars. These 1, 2, and 3 rooted teeth lie behind the canines, servicing to crush the food along the molars. The premolars are numbered from 1 to 4 in the dog, with the one closest to the canine being considered the first premolar. The upper 4th premolar is the largest premolar, possesses 3 roots, and has a rather large chewing surface. The lower 1st molar is the largest mandibular tooth and possesses 2 roots. These teeth may be difficult to visualize, but are very important in the crushing and chewing of food. The cat, with its smaller mouth, does not possess as many premolars and molars as the dog. The premolars are numbered 2, 3, and 4 on the top, and 3 and 4 on the bottom, with only 1 molar up and 1 molar down on each side. Let us review. Incisors across the front, the canines at the corners, the premolars along the sides, and the molars in the back. Just as people have a set of baby teeth or deciduous teeth, so do puppies and kittens. These smaller, sharper, deciduous teeth are often instrumental in evaluating the age of a young puppy or kitten. Here are some practical pointers to remember in aging a puppy or kitten. First, they will generally lose their first deciduous incisors, or those in the very center, at approximately 4 months of age. The adjacent incisors will simultaneously be replaced by their permanent counterparts over the next few weeks. A permanent tooth and its corresponding deciduous tooth should never be occupying the same space at the same time. This creates crowding as well as other dental problems. By 5 to 6 months of age, most young kittens and puppies will have lost their deciduous canine teeth. The permanent canines will take several months to grow to full length. The permanent canine teeth are much less sharp to the touch than their deciduous counterparts. By 6 or 7 months, the premolars and molars should have fallen out and are being replaced with their larger adult counterparts. The aging of dogs and cats beyond this time period is generally done by evaluating the wear patterns and accumulation of tartar onto the tooth surfaces. This is quite a bit more arbitrary, as various eating and chewing habits can markedly affect these features. Establishing a home dental program for most pets is very helpful in preventing many future dental problems. Such programs will result in a reduction in bad breath or halitosis and a reduction in the frequency for professional dental cleanings. Dog owners especially can brush their pets' teeth daily or every few days, producing a significant reduction in plaque and the gingivitis that often accompanies it. Plaque eventually mineralizes to form calculus, also known as tartar. Cats may be more resistant to such procedures, but just about any home care that owners can provide will help. A number of commercially available veterinary toothbrushes will work very well as the cleaning instrument. A thin washcloth or gauze pad wrapped around one's index finger also works quite well and gives the owner a good feel for the location of the teeth they are attempting to brush. Finger brushes are also available and work quite well. An owner should be cautioned not to take unnecessary risks if their animal is not accepting of someone touching their mouth and teeth. Home dental care should begin with getting the pet accustomed to being handled around the mouth. The owner should begin by gently controlling the muzzle. After the dog submits to this, the owner can begin to expose and touch the teeth. The teeth that we need to expose for cleaning are primarily the canines, the premolars, and the molars. In small dogs that are very prone to periodontal disease, it is very important to brush the incisors. When brushing the incisors, a circular motion can be used, but using a sweeping motion to remove debris between teeth is ideal. The brush bristles are aimed at a 45-degree angle to the gums, and then the brush sweeps towards the tooth crown. This cleans material and debris better from between the incisors that are closer set together than the premolars and molars. The inside surfaces of these teeth are not as likely to build up tartar, and most dogs and cats are much more reluctant to having their mouths open to expose these surfaces. Once the pet has become comfortable with the owner handling these areas, the actual cleaning can begin. It is, however, advantageous to let the dog become familiar with the brush and taste of the toothpaste prior to the first cleaning. Human toothpastes occasionally have been shown to cause significant oral irritation in some pets and have foaming agents that may be poorly tolerated. Additionally, most human toothpastes contain fluoride, which can be toxic, causing renal or GI damage if swallowed. Special veterinary toothpaste should always be used. The pet toothpastes available often contain enzymes that are both safe and effective with pets. The taste is also geared to the liking of animals versus those of people. Malt and poultry flavors are especially popular with pets. 15 to 30 seconds of a gentle circular brushing on each side will generally remove a substantial amount of the plaque that, if not removed, leads to tartar. In dogs and cats that are not tolerant to physical brushing, a number of oral rinses are available. These rinses often contain antimicrobial agents that help prevent plaque buildup by attacking the bacteria associated with plaque and tartar. Occasionally, these antibacterial rinses are used prior to the scaling of very infected teeth. This reduces some of the bacteria that the person cleaning the teeth, as well as the patient, will be exposed to. Finally, remember to reinforce to pet owners the value of constructive chewing in retarding the buildup of plaque and tartar. Dry food, flexible raw hides, and other crunchy snacks are all a part of keeping the mouth clean and healthy. Diets such as Hill's TD will actually produce additional abrasive action and slow the process of plaque and calculus buildup through a patented mechanical design. In the next section of this series, we will discuss techniques and procedures for proper professional dental cleaning.